Hi, I'm Simone Boone, Director of Barefoot Medicine Limited. Treating symptoms doesn't work, so I've developed and trademarked a system called the Daring Approach to Healthcare. This is a combination of integrated medicine, lifestyle medicine, functional medicine, nutritional therapy, mindfulness and meditation. In short, it's a health strategy that gives you a personalised plan using a tailor-made natural approach. Here's how it works. D stands for discover, and the discovery phase is where we find out more about your symptoms and how they affect your mind and your body and your spirit and your lifestyle. The way we do this is first of all with a medical symptoms questionnaire, which is about how you are at the moment and how your symptoms are impacting you. And then you'll be given a score out of 200 so that as the treatment strategy progresses, you can complete it again and we'll make sure that this health strategy score is coming down so that we can see the impact of the interventions. You'll also be invited to complete the World Health Organization Promise Scale, which is about how your symptoms are affecting your quality of life. That's very, very important in functional medicine or lifestyle medicine because you're more than just a collection of symptoms. We need to look at how it affects your life. And again, this is something that would be repeated after all the interventions to make sure that your quality of life improves as a direct result of this personalised approach to your healthcare. Of course, during the discovery phase, we'll also have a one-to-one consultation that can be done over the phone or via a video link. And then once I've got all of this information, I will piece it all together so that we can formulate a story of what has happened and brought you to the point of where you are now, right from birth, because a lot of things may have begun early on and your body was a bit more forgiving, but over time you're finding strange symptoms creeping in and you may not link them all together. That's why it's important to do all these detailed questions in the early stages and put a timeline together so that we really understand not just the progression of your health condition, but also the likely trajectory if there isn't an intervention. So that's D, the discovery phase. The next one, A, is analyse. And that's simple. Test, don't guess. We use state-of-the-art lab tests, non-invasive, so I don't tend to do blood tests. I can order them for you, but I don't find the need to, because I prefer to do stool analysis, urine analysis, and maybe breath or sometimes a finger prick test, finger prick blood spot test if it's food allergies. But generally speaking, what happens is the testing kits will be sent to your home and you provide the sample and then the courier comes and collects it and whisks it off to the lab, and then round about 3 or 4 weeks later I will get your lab results back. And then that takes us to the third stage, which is R for report. So your health strategy report will be a combination of all of these results. So your medical symptoms questionnaire, your Promise health score from the World Health Organization, all the findings and things we've discussed in our one-to-one consultation, and the timeline as well, and the matrix. The matrix is an important part of the report because this is where we take all of your symptoms and life events, and I would then look at them and say, okay, what did this mean for you physiologically? Which body systems were impacted? And this is the main difference between functional medicine and going to your conventional doctor. If you go to a GP, they will ask you about your symptoms and give you a tablet, a pill for every ill, if you like, and also kind of one size fits all. If you've got a headache, have a painkiller. Whereas here, I look at your individual life circumstances, your lab results from stool analysis, and what they tell me that what nutrients are missing. And then we look at which body systems are most severely impacted. Is your immune system the weakest? Is it your digestive system? Is it your hormonal system? And then we put it in order. So of the 7 body systems, we look at which are being most severely impacted, because that's where the low-hanging fruit lies. If we can support that body system, then a lot of your symptoms will improve because we've tackled the problem at root cause. So that's what the report is about, and that will be your health strategy. The next phase in the daring approach to healthcare is to integrate. I is for integrate, where we integrate a solution into your lifestyle. I think a lot of people's health issues don't work because they have very optimistic initial expectations. I'll do this and I'll do that and I'll go to the gym and I'll lose weight and I'll do a diet and everything else. But it's not a sustainable and lasting, realistic approach, because we all have different life events that broadside us, we have different pressures, we have unforeseen circumstances come about. And so when I look at integrating lifestyle changes for people, we do it in a measurable, manageable way that is prioritized, so you know where you're going to get the best results, but I also help you to understand what the timeline is likely to be. So if you go to the GP and you take antibiotics, you expect something to be killed within 2 or 3 days. If you take a functional medicine approach, what you're doing is altering your body's systems so that your body is stronger in the long term. But think about how long your symptoms have been going on, particularly in chronic health problems, and then ask yourself how realistic it is to turn that around in 2 or 3 days. I think, when you take a tablet, you mask symptoms, you don't actually solve the root cause of them. And that's the difference with functional medicine. We look at how your body systems are functioning and then we improve that. So the integration phase is going to depend, or how long it is depends on what your lifestyle commitments are and how much time you have got to focus on this or what else is going on in your life. So the integration phase is different for everybody. N stands for nourish in our daring approach to healthcare. And nourish means nourish your body and your mind. So nourishing your body, obviously this is where we use your food as your medicine, but in the short term, it could also mean short-term supplementation based on your lab results. So if you've had a metabolic analysis done and the results come back in a kind of traffic light system where anything in the red zone means that your body is severely lacking those nutrients and therefore certain biochemical reactions cannot happen, then we would recommend supplements, or in fact the laboratory recommends supplementation and also tells you the dosage in the report. So no more guessing when you're in Holland and Barrett being sucked in by all of their marketing saying, hey, this supplement is wonderful, this is a superfood, this is fantastic, and pay lots of money for it. It's all very tempting because they know exactly what you want to hear. But with our testing, with the metabolic testing, with the gut function testing, this is a result of what is going on in your body. So we get the test results back and we can see if something's in the red zone, then it does need to be supplemented. If it's in the amber zone, then you would benefit from supplementation. And if it's in the green zone, then you've already got enough. And so it's a very personalised healthcare plan. And it's also a way of getting faster results because you're giving your body exactly what it needs and you're not wasting your time or money on things that it doesn't need. Of course, in an ideal world, we want to use your food as your medicine. You can only do that if your digestive system is strong enough. So if somebody's got, for example, irritable bowel syndrome, or even if you're suffering from stress and it gives you alternating constipation and diarrhea, then your digestive system is not functioning properly. So how do you use your food as medicine? Well, we've got solutions for that because it's extremely common. So I can talk about supplementation for that and how to, again, integrate foods that are easy to digest. Now, some people will want online meal plans, being told, here's the recipe for every meal and here's your grocery list for the next week. So if that's you, then we can do that. Other people, however, have a family life and some people will eat some things and not others. And those people maybe just want guidelines and lists about what is going to be good for them to eat and what's better avoided. So again, that's also possible. The Institute for Functional Medicine has a lot of handouts and booklets and brochures, and I've made videos. So there's all sorts of information, and depending on what works best for you, I can give you the information that you need without overloading you with all the stuff that you don't need. So that's N for nourish. And then finally, the G is the guide to sustained recovery, because you need this to work for you for the long term, and with a good understanding of the root cause of your health and how your daily choices can impact your long-term health and will also affect life events going forward. So whether you're a lady going through menopause, or in fact a man going through the lesser understood andropause that people don't talk about but is a huge issue. If you have the right nutrition and mindfulness or hobbies or whatever it may be, if your lifestyle is more balanced, let's say if you have a work-life balance, then you're less likely to have adverse symptoms of menopause and andropause, or you're less likely to have problems as you get older with weak bones or whatever it may be. So tackling stress at this stage proactively is vitally important for your health in the future. So this guide for sustained recovery is a booklet that you will be able to refer back to. You'll see your test results in it, you'll see what your strengths and weaknesses were, you'll see which body systems needed to be addressed in which order. So it will give you some pointers down the line, a year later, 2 years later, it'll give you some pointers as to what you can do to help your health. And then also you can refer back to it. Maybe in 12 months' time you'll want an annual health check and have some of the labs done again to see how your gut microbiome has changed, or your hormonal levels, or your metabolic levels, because of course everything changes in your body. It's like ebb and flow. So you will have an idea of which tests you need to have done and what you need to do to improve your own health. And of course, when you understand your own health, you will also have a better understanding of your family's health as well. So that's the daring approach to healthcare, where I'm your partner from discovery to recovery. And as you can see, taking this daring approach to healthcare is the smart way to be as healthy as you can be naturally. It works for the prevention and the treatment of long-term chronic, particularly stress-related health conditions. But because it's so highly personalised, it can be adapted to fit into your existing lifestyle and your primary healthcare routines. So I often work with people's doctors or physiotherapists, osteopaths, nutritionists, whatever it may be, to integrate all of these lifestyle changes into your existing primary healthcare pattern. I would say that this solution is for you if you believe that being proactive in your own healthcare is the smart way to reduce or eliminate the need for pharmaceuticals and even surgery. It's particularly good for anyone suffering from stress and anxiety, chronic fatigue syndrome or long COVID, irritable bowel syndrome, or even just any sort of digestive discomfort or upset, high blood pressure, infertility, both male and female, migraines. Functional medicine is particularly good for autoimmune conditions as well. And I would say for long-term pain, so fibromyalgia, or if you're waiting for surgery for hip replacement. The thing with long-term pain is if you are in pain, you're less mobile. And the moment you're less mobile, your body's detoxification processes can't work properly because they don't have a pump of their own to get the toxins out of the body. So normally toxins are eliminated by physical movement and exercise, which of course is going to be eliminated, is going to not be an option if you're in pain. And then if you're less mobile and the toxins are building up, you're going to be putting on more weight than you would ordinarily do. And then that becomes a vicious circle, doesn't it? Because then the more weight you put on, the more health problems you're likely to have. And so functional medicine is a great way to not just prevent health problems, but it can stop things from worsening by supporting your body to be the best that it can be naturally. So if this daring approach to healthcare makes sense to you, then please feel free to set up a discovery call where we can find out if it's right for us to work with each other. Because functional medicine isn't for everybody. Not everybody's ready to be proactive and make changes in their lifestyle. And also because I'm limited, because I work so closely one-to-one on personalised healthcare plans, there's a limit to the number of people I can take on at any given time. So there's no hard sales, there's no pressure for you to go ahead. Let's just have a chat and see whether this could work for you. And if you'd like to do that, then please click on the button and you'll have access to my schedule and you can book in an appointment with me, and I will look forward to speaking to you very soon. Thanks for your time.